Yeah. Well, I mean, it's fortunate that one manufacturer makes both drugs. It makes eventual access to both down the road, as well as the utility in a trial for tirzepatide and ixekizumab, together. I mean, mechanistically, it makes a lot of sense when you see what GLP-1 agonists do under the hood with the immune mechanisms. There's a lot of impact on NF-kappa beta as a neurotransmitter, both interleukin 1, interleukin 17 pathways are actually inhibited or at least modulated by their impact. Tumor necrosis factor, which obviously we know again with psoriasis has a lot of role as well, being suppressed just by tirzepatide alone. Then you add just the active ingredient of what ixekizumab does as an IL-17 inhibitor. So I think from the standpoint of the combination of the two mechanisms, you really have a lot of potential synergy as well as activity against the immune cascades that work. When you think about what a patient who has a high BMI, for example, might be experiencing in terms of insulin resistance, in terms of the psychosocial, changes obviously that go along with being heavier, and then of course, the lack of ability to exercise, some of the other components of intertriginous, friction and all those other components. I mean, there is a lot of evidence that support that if you can find weight loss methods in these patients, they will do extremely well. And I think that expands not just from psoriasis, but you'll see that with hidradenitis suppurativa as well. But in the study, they actually showed that 40% of the subjects who were treated with both drugs, with both active agents, experienced PASI 100 as opposed to ixekizumab alone. So I think from that data alone, you see the benefit of the additive effect. Obviously, it's a shot a week for those patients who are on the tirzepatide arm, but many won't care, to be honest with you, as long as they see what they're getting in terms of quality of life and improved health. So a lot of opportunities to improve these patients along. Now, again, these were at 36 weeks, which again, the to remind patients, this is a marathon, not a sprint, even though these drugs all work very fast. Well, that would be interesting, to see what tirzepatide alone could do, maybe in a pilot study or a proof of concept study. I don't think it would be something that would reach a phase 3 pivotal type of trial where you're looking for label. But to see just the individual effects, you could probably make the case that an additive arm of tirzepatide alone to the combination of the two and the ixekizumab alone, it'd be an interesting comparison of those three side by side, not just the combination of the two. Now, intuitively, I would think again, you still need an anti-psoriasis mechanism, but there could definitely be some improvement. Again, a lot of psoriasis patients, they'll say they cut out drinking alcohol, they improved their diet, they started exercising, and their psoriasis improved. Is that a function of insulin resistance? Is improving? Is that a function of the anti-inflammatory improvements from their quality of life changes? I mean, there's a lot of evidence to bring that up as well. So to say that GLP-1 agonists might provide that same benefit, I could see how that would happen. But if dietary and exercise modification does that as well, then I think we have the scientific benefit or the scientific knowledge from there alone.